And I'm Helen Haskell from Mothers Against Medical Error. I just want to introduce Regina, who's one of my old friends in the patient advocacy movement. 3 years ago, another friend said to me, you know, there's this young woman in Washington and she's painting a mural, and I'm going to be sending money to her. And I, well, you know, what is this? So she said that was Lisa sent maybe her $50 or something. And so, you know, I looked it up and found this mural, and was really intrigued and moved by what Regina was doing, because her husband had just died of cancer, and she was recounting on the wall of what looks to me like a filling station the story of his hospitalization in the mural that she talked about yesterday, called 73 Cents, and you'll see it here. And since then, Regina has made other murals, and she's branched out. She got a lot of attention worldwide for that first mural. And she has since then created a network of artwork for the patient advocacy movement, which has really been powerful. One of the things she has done is created the walking gallery with jackets on which she paints a portrait of people's stories with medical harm, with the medical system. And she has, 120 of those jackets now?
I painted 120, and an entire gallery, there's 140. There's a few other artists.
And from time to time, she has meetings of the walking gallery. There's one in June, I think, in Washington, where everyone comes in their jackets. Anyway, Regina has been really one of the remarkable people who sort of bridged a lot of areas in the patient advocacy movement, and has bridged from art to science, if you will. So I am really honored to introduce her. She's going to tell us about her story and about the power of long patient stories. Thank you.
We're going to be starting with a video. This is actually a presentation that was done by two documentary friends. When I began mural advocacy, I emailed 1,000 people about, does anybody have a wall? And only 2 people responded that they did. But this documentary team said, we have a camera, and we'll film the whole process. So this 11-minute video is actually being streamed at film festivals right now for mini documentaries. And I think it's pretty powerful. I thought it would start the day. So much for watching that. You're part of the small group of people who've actually seen it. Since it's still in the screening stage, it's not available online, and it's only available as a DVD. I am so honored to be here and having the opportunity to speak in front of you. I spoke briefly yesterday and sort of explained what I do. And I listen to people's stories, and then I figure out what the visual of that story is. And I do it within medicine. I did it for my husband for a year solid. After I painted that painting, I painted several other paintings, and they were all about his story and our life together. But when you're a patient advocate, your story is only one of many. And as you grow and change and meet wonderful people like Helen, you start learning more stories, and you start connecting those stories to each other. Those powerful long stories that represent somebody's life can change the way we appreciate medicine and treat people in this country. And this, for instance, is a picture of somebody's story. This is called the sycamore tree. I don't know if anybody's heard of the plan, tree method of care, that patients should be center and that we should talk to them and be through the entire process. Well, the plan tree was a sycamore tree. Through our culture, through our religion, we have a culture of belief that we stand under trees and we talk to our brethren. We talk to them about their lives, and we tell parables and tales that help them understand what it is they need to do, what is right. And we teach those stories to our younger generation and our children, and they stick within us for the remainder of our life. See, when I was a child, the stories I learned were, yes, my childhood was full of Bible stories and fairy tales and things like that, but it was also full of 1970s television. And those shows my husband watched and I watched, and they affected our lives. And those stories made us understand how to be patients. Wow, television can teach you how to be a patient? Well, it could, at least in the 1970s. I actually had a wonderful conversation with a series of IHI fellows about this painting, and it created this painting, which was, think about the characters that taught you how to advocate for yourself, or taught you to appreciate what was going on in medicine. For instance, for me, Grandma Walton, huge. When I was a child, I was really little, and she was on the show, and I loved her, and she was the best grandma ever, and she stirred cookies, and she was so nice to the kids, and then one day, she just disappeared. And she was just gone, and nobody explained why. And then a year later, she came back. And she was on the show, but she wasn't the Grandma Walton I knew. Now she could barely talk, and her face was sort of fallen, and she had a different voice, but she still loved her family. See, the woman who played Grandma Walton had had a stroke, and the producers, instead of writing her off the show, killing the character, brought her back. And years before ADA was passed, on national television in this country, we had somebody who was suffering from a disability and still acting. But it didn't stop there. There was Quincy. Quincy was this medical examiner. I loved that show. Amazing work ethic. He worked so hard to solve the cases. And he was played by an actor named Jack Klugman, and one episode was written about rare disease and how incredibly important it was to get certain drugs for people who are suffering from conditions that they can't get drugs for in this country. And because of that episode, Jack Klugman testified before Congress. It was the first time a celebrity had testified before Congress. He wasn't a doctor, he played one on television. And he was in there, huge packed house, and he helped pass the Orphan Drug Act, to this day allowing individuals to get the drugs they need to provide care for them. But then there was Hawkeye Pierce. MASH in the early 1980s had their final episode, and that final episode of MASH was so incredibly popular that it did not match in viewership until the 2010 Super Bowl. This was 1983. So pretty much almost everybody in the country was watching MASH that night. And most shows, when they're going out, they go out with a bang. Maybe a song and dance number, maybe the whole cast gets married, potentially they go to Hawaii and have a trip, but not MASH. If you were one of the people watching that night, you know exactly what happened. You watched a doctor that you loved, that you knew was brilliant and wonderful and funny, have a complete nervous breakdown because of a chicken. He said to the psychiatrist, I was in the bus and the military was there, and if they found us, they could shoot us, and the woman had that chicken on her lap, and the chicken just wouldn't shut up. So I told her to make the chicken be quiet. And she did. And as the episode progresses, we realize as viewers, it wasn't a chicken. It was her baby that she smothered at her own breast. And he was a doctor, and he caused that. So what America got to watch was a doctor they love fail and have to deal with that and come back to himself. But it didn't stop there. We also have The Incredible Hulk, which, The Incredible Hulk, that's silly, right? It's a kids program. It was like on 7 o'clock at night. But if you go back and watch the pilot of The Incredible Hulk, the first 30 minutes of that episode is a man with all-consuming grief over losing his wife because he couldn't lift up the car. If he could have just lifted up the car, he could have saved her. If he could have just broken in, he could have saved her. And we watch an entire series arc of a man who everything he does is because of the death of his wife. But personally and medically for me, the one that affected me most was Mary Ingalls. Because Mary Ingalls, when I was in 4th grade, had an episode on Little House on the Prairie where she couldn't see the chalkboard. And she went like this, and she said, can I go in the front and sit on the front bench? And did all this stuff. And I'm like, Mom, I'm Mary Ingalls. I'm exactly like that. I'm doing all those things so I can see the chalkboard in the school. And my mom said, no, you're only in 4th grade. You don't need glasses. I said, yes, I think so. I saw Mary. I'm doing the same things. I need an eye appointment. And I got an eye appointment. And I gotta tell you, it was the best thing ever. Because before that, we were an uninsured family, so the only time we went to the doctor was when we were so sick we couldn't get out of bed. So my mom would carry me to the doctor's office and set me on the little table, and the doctor would come over, he'd look at my mouth, he'd look at my ears, he'd look at my eyes, he'd walk away from me and he'd say, Mrs. McCandless, your daughter needs antibiotics, I'm gonna give you a prescription, make sure she has plenty of fluids and she should be fine. And then he'd leave. And he never talked to me. And that was not the eye doctor. The eye doctor put me in this chair that was like a throne. There was a special cup for my chin, and then he started sliding these glasses in front of me, and he went click, click, click. And then, the best part, he said, is this one better or this? A or B, 1 or 2? And he did that for like 30 minutes. For 30 minutes, I was a 4th grader in charge of my own medical care, and I loved it. And at the end, all the glasses slid into place, and I could see. And that next week, I got my glasses, and I could see leaves again for the first time in years. And it was beautiful. Well, time passed, and I grew up, and I went to Oklahoma State University, and I was a sophomore, and my husband went to Oklahoma State University as a master's student, and we both enrolled in the same class. It was called Scenic Painting, and I was very excited because I love to paint, and he was taking it because he thought it was going to be a blow-off. But it wasn't, and it was a lot of work, and we were both procrastinators, so what would happen the night before the project was due, we'd both arrive at 10 o'clock at night and start painting. And we'd paint, and we'd paint, and we would fight like you cannot believe, because we were pulling an all-nighter. Now, I don't know if you've pulled all-nighters with people on a regular basis. All the filters come down. So we talked about religion and God and entertainment and Stephen King, because we were huge Stephen King fans. And we did this all night. And after an entire semester of throwing paintbrushes at each other and having huge arguments, we realized we had actually fallen in love. In the best way you possibly can, because you've seen it all already. Well, time passed, and we had 2 wonderful sons, Freddie and Isaac, and the years rolled by, and my husband got a PhD in film studies, and he was working multiple jobs, and I was working multiple jobs, and we were trying to keep our family together. We'd also recently got a diagnosis that our eldest child had a high-functioning autism, and we were trying to figure out how to make school work with him. And this picture, we have one family picture due to the wonderful thing that is called Olin Mills photography, because this picture was taken at church at 9 o'clock at night during the Christmas season, and I worked in a toy store. So after a 10-hour shift, that's me with my family, and thank God for that. Now, going past 2007 into 2008, we had been really struggling. As the video said, we'd been working 5 jobs, and it was really hard. So we had a series of New Year's resolutions. They were simple things, like we need insurance for the whole family. We need to get Freddie into a special needs school that can deal with the fact that he has autism. Fred needs to get a job in his field. We need to spend more time together as a family. And finally, we would really like a 2-bedroom apartment, because we're a family of 4 in a 1-bedroom apartment in a metropolitan city. And it was really challenging, but we were trying to keep it together. And you know what happened? Our prayers were answered. My husband was hired by American University in a full 1-year appointed position between 2 departments, and he was just going to work so hard. And he was a little bit fatigued that fall, but we chalked it up to a new job. And then as he got more tired, we went to the doctor, and she said that he had hypertension, which I thought was sort of odd because he'd been losing weight and he'd been getting fit. And I thought hypertension happens to people who aren't doing those things. But they said, we'll put him on medication that should deal with the problem. And then January of 2009 happened. In January, my husband said he was having very bad rib pain. And he went to the ER, and they said that he had broken a rib coughing. Well, he was only 38, so I thought that was rather odd, but they said, yeah, well, this happens sometimes with a bad cough, and he was given pain medications. In February, he had bad back pain, and he was having trouble sitting and having trouble walking, and he kept going back to the doctor every week, and she kept giving pain medication. But we didn't know that when you take pain medication, you need to be prescribed a laxative. So he started having another problem that he was very embarrassed by. And I said, honey, you've got to go back to the doctor because we've got to deal with the other problem. And he went back, and now she prescribed laxatives. By March, he was on 4 types of laxatives, 2 types of muscle relaxants, and 4 types of pain medication. And we had no idea what was wrong with him. On March 13th, it was a Friday, and he was in so much pain that we went to the local Pretty ER. It has the stained glass windows and the pretty blue couches and a great gift shop and a coffee shop, and it's where you go if you've got little kids and you're trying to go to the ER. And we went, and I grabbed a bag of toys for the kids, and we went in there, and they played for 3 hours while we waited and waited for someone to see my husband. And finally, they came up to us and said, "We're backed up. We won't be able to give a CT scan or an MRI tonight. You might as well go home. Here's some more pain medication. Go see your doctor next week." I went to the doctor next week with my husband, and they said, I went into the office with my husband because I was worried because he'd been prescribed so much pain medication, but we didn't know what was wrong. And we went into the office, and he laid down on the table, and the doctor came in with a flip chart. And she said, "So, Mr. Holliday, I think are you depressed?" I said, "Well, of course he's depressed. He's in excruciating pain all the time. I think there's something maybe wrong with his kidneys, and I want an MRI." They said, "Well, it's probably just a protuberance of lumbar 5 based on his x-rays." I said, "No, we've been doing this for 3 months now. I want an MRI, and my husband's claustrophobic, so I want an open MRI." And we found one in Olney, Maryland, which is like way outside the city. And he drove all the way to Olney, and they did the CD, and he took it in his hand and drove all the way back into the city and gave it to the doctor. And then 4 days later, she calls and says she would like us to make an appointment with someone she knows the next day who's an oncologist. And I knew so little about medicine, I didn't know what an oncologist was. I had to look up online to find out that's a cancer doctor. We went the next day to the hospital, and the doctor saw he was in so much pain, he said, "We'll just admit you for tests." And I got my husband all set up in the room, and I made sure his pillows were fluffed, and he had water nearby, and I thought I could leave him. I thought that you could leave people in hospitals and they were okay. I thought I could go home and take care of the children and go to my job. And I did that. On March 27th, I was in the toy store and I was selling toys to a couple when my boss came to me with a phone and said, "It's your husband." And I picked it up, and my husband said, "Reggie, I'm so scared. The doctor, they were just in my room, and he says that I have tumors and growths in my abdomen, and I have a 3-centimeter tumor in my kidney. I'm so frightened. Could you get here as soon as you can?" And I left, and I went as fast as I could, and I got to the hospital in 30 minutes, and when I got there, I calmed my husband down, and I said, "I'm going to find out exactly what's going on," and I started asking questions. I went in to talk to the doctor, but he'd left town for a medical conference, and he would be gone for the next 4 days and would not return emails or phone calls. So we just sat around waiting for someone to talk to us, and I'd ask housekeepers and techs and everybody what's going on. And they wouldn't show us the medical record or any test results. And finally, on the 4th day, an on-call doctor came in the room, and it was me and my husband and my in-laws just all sitting there waiting. And she went right up to the PCA pump and started looking at the bolus amount and didn't even talk to us. And we said, he had 2 more tests. He had what's called a bone scan and a PET scan, and we need to know if it's spread because that's what those tests are supposed to tell us. And she said, "You mean no one's talked to you?" I said, "No, no one's talked to us." "Oh, well, it's spread. It's everywhere. It's in his bones and in his lungs." So that night I went on the computer and found out my husband had stage 4 kidney cancer. And the likelihood of him surviving was not good. When the doctor came back in town after the medical conference the following week, at 7:30 rounds, he went to my husband and said, "Mr. Holliday, I understand your wife's been asking questions about your case." Now, my husband was a good man. He didn't make waves. He was the kind of patient you'd love. He smiled and was cheerful and thanked everybody. He even gave us fruit displays that people sent to the nurses' station because he said they worked so hard. So when the doctor asked him that way, he was frightened. He said, "Yes, she's been asking questions." He said, "Well, if little Miss A-type personality has questions, she needs to come to my office hours." And so the next day, I dressed in my church dress, and I went to his 9 o'clock office hours. And this is a painting of that day, and the only thing that's not realistic within the painting is I didn't kneel at the actual doctor's office. I sat in a chair. But I will tell you, I was emotionally kneeling. He never closed the door. He never stopped talking on the telephone and taking calls. He never turned that computer screen around so I could see what in the world he was talking about. A nurse kept coming in talking about the parking problems in the parking lot because that one employee keeps parking that car in the wrong space. And then another transport clerk was talking about what's going on with Miss Rosen's chemotherapy for that afternoon and which suite was available. All the while, he's talking to me in between very rapidly with all these long words that I do not know. And I say, please, I'm writing all this down. Could you just slow down a little bit because I have to research this online? And he said, I don't like people who research online. I said, I'm sorry, but I don't have a background in medicine. My only way to understand you is to research it. He said, that's right. I'm the one with the medical degree. So in the back of that room, there's a diploma in that wall, and it says, I have a medical degree. And across it is a picture of his family. But if you look in the very background, that's our family behind it. Because this is the moment that our family was broken apart. Lots of things happened when you become part of the medical system and you've never been there before. Like your visitor tag going into the MRI machine because they didn't tell you you might want to take that off. The other thing you realize is that patients have less access to sunlight than prisoners do. My husband had 46 ambulance transports in the 11 weeks he was hospitalized. And I did the math one time and figured out the minutes of sunshine that he had in 11 weeks added up to about 3 hours. Every transport was excruciatingly painful. He had metastasis to the lower spine and eventually a broken hip. But he cherished his minutes of sunshine. I found out there's this thing called a pain chart. My son, when he saw this, he said, that is horrific. Because he goes to an autism school, and in autism school, they actually teach you how to read faces. And he said, guess what, Mommy? Those aren't real. Faces don't really look like that. We need to look at real faces when we talk about pain. We are living in a society that's conditioned when you say, are you all right, to say, I'm fine. But your face, it will usually tell the truth. But please look up at people and actually look at their real, true face. And then there's ID tags. If you've been in a hospital a lot, well, there's a few things you really can't stand about ID tags. One is that in some hospitals, visitor tags are placed on a person's body and they say visitor 6218. There is no name. Now, Le Bonheur Health, I love them because they put your name on the tag. But a lot of hospitals don't do that. So we had a Jewish friend who came to visit us, and guess what he had to do? Put a number on the front of his lapel and come in as a number. That's what a visitor tag that's number only makes you feel like. And then what about the tag flip? I have seen virtually no facilities that make a ID tag both-sided. So oftentimes, when a person's doing the natural work that they do, it flips, and you can't tell who they are. This is something easily solved through technology, and there are amazing people working on this. Or how about that bedside tray table? My husband became incontinent within 2 weeks. So I saw what was done. Now, I taught preschool for 8 years, and I know we would lose our accreditation if we ever served children off a changing table. But every single facility we were in would use that bedside tray table to do an incontinent bedding change and then feed him within an hour thereafter. Oftentimes, the only thing that cleaned it, if it cleaned it at all, was a little bit of the antibacteria stuff that they had in the hallway. Unacceptable. Most of those trays are also made of a melamine-type surface with a rubber bumper that very rapidly has bacteria encroach. This should never be an accepted way we treat patients. After weeks of this, I went down to medical records and asked for a copy of my husband's medical record. I was told it would be 73 cents a page, and I was outraged. So outraged, I decided to paint about it for 3 months, because that was unacceptable. Some people say I must have not tried very hard to get my husband's medical record while he was hospitalized, but I point out this story to tell you how that's not the case. When my husband was sick and I started realizing how ill he was, and we were huge Stephen King fans, and there was a new book coming out in the fall called Under the Dome, and he was so excited about it, and I knew I had to do whatever I could to get that. So I emailed the book buyer at my toy store, and she emailed the publisher rep, who emailed the marketing director, who emailed Stephen King. And Stephen King said, yes, he would give a galley copy of an unpublished book to this dying man. So we got a galley copy from an A-list author 7 months before it became published, but yet could not get the medical record in the facility in which he was staying. The day after I went down to medical records, it was a Saturday, and my husband and I, what we would do is we'd wrap little presents for our children on Saturdays because they visited on Sundays. And because it was so horrifically hard to come to a hospital with an autistic child and a 3-year-old, we would have an Easter egg hunt every Sunday in the room. It would be of presents. And he'd find them, and they were the best ones, right, with Daddy, right? And so that was what I was doing. I was wrapping presents when the doctor walked in. And he was as far away as you are right now. And he stayed by the door. And we had a list. We have a list we take to Fred's bed. So just in case the doctor comes in, there's the questions he's supposed to ask. And there are, when are we going to get what's called a palliative pain consult? When are we going to get the walker you promised so he can try to walk again? When are we going to get chemotherapy? And when are we going to get surgery? And he said, don't worry about the list. We've decided we're sending you home on a PCA pump. But you said you were going to treat us. We know what that means. He was saying that we were being sent home to hospice without even saying those words. We said, well, we live in a 1-bedroom apartment. How is that going to work? The doctor said, well, that's the discharge nurse's problem. And then he left. He left on a Saturday. And there was nothing we could do. So that's when my husband turned to me. My good husband who never made waves. He turned to me and said, you go after them, Regina. You try to get me care. And I couldn't do anything on Saturday, and I couldn't do anything on Sunday, but Monday I fired the primary who never visited us. I said, I want the oncologist barred from this room. He's not to talk to my husband anymore. I'm going to find a new oncologist, a new hospital, and a new primary. My primary is willing to take my husband on. And all of a sudden, the nurse navigator from the insurance company was working with me day in, day out, trying to get an ambulance transport. It got so frustrating by the end that the insurance nurse navigator was crying to me on the phone. Crying and saying she wanted to bring her Ford Explorer to the hospital and we'd load him up ourselves. I said, calm down. We're going to make this work. And on the 5th day, we got transfer. We were sent with an incomplete and out-of-date medical record and transfer summary. That meant when my husband got to the new facility, he was denied care other than a bed. They said, we can't even feed him because we don't know his dietary orders. But we won't see you if you go downstairs to the pizzeria. So that's what I did. And for 6 hours, they worked on cobbling together his medical record with a phone and a fax machine until finally they had his orders in place. And this man who was in excruciating pain could finally get back on Dilaudid. The next day, the doctors came in the room. And it was a beautiful moment because you know what that doctor did the first time he saw my husband? He held his hand. He held his hand and made him feel real. And he was so happy somebody did that. He's like, look, honey, he touched me. And he didn't even have gloves on or anything. And then they took me aside. And they said, we want you to go back to the first hospital and get the whole medical record, the films, the CDs, everything. And I laughed at them. No, I've tried that. They won't give me the medical record. He said they will this time. You're just a courier. And I went back. And they printed it out in an hour and a half for the new doctors in charge of my husband's care. And I gave it to them, and they read it. And then after an hour of reading it, they gave it back to me. Now, this is about 200 pages. So it's like, don't you need this? And they said, no, there's nowhere to put in our system. We just had a look at his back history. You've got it now, but if you always have it, he's going to have the best care. In the next 3 hours, I read my husband's entire medical record. And as I read it, I got angrier and angrier because it was full of medical errors. There were 13 major medical errors, but it was also full of actionable data that had not been acted upon. when my husband was first admitted into the hospital, he had a distended bladder. It said so on the test results of 325, and on 326, and on 327, and on 328. The nurse's progress notes of 4.7 say, concern, patients retaining urine. And then on the radiology report of 4.10, patient's bladder dangerously distended to point of rupture. Now, the radiology was a transport. So she came up to me and said, listen, I just did your report, and I just called your hospital, and I called your doctor, and they're not returning my calls. So I want to let you know, because you're in charge of making sure they place a catheter in your husband when you get back to the hospital, because no one's talking to me. So when you get back, that's your job. So when I got back to the hospital, I said, okay, my husband has a history with a urinary tract stricture, so I know placing catheters is going to be hard because he's had it done twice before. So you're going to need a urologist because this isn't going to be easy. And they're like, no, we're nurses. We know what we're doing. We've done this before. I'm like, okay. So they tried with a 16 gauge, and they tried with a 12 gauge. And after he was crying in so much pain, they called the urologist, who got there in another 24 hours. And finally, we had catheter placed. And all of that was in my husband's medical record. So what I did was I created a visual example based on the nutrition facts label of my husband's medical chart. Everything everybody should know about this man before they touch him. I color-coded it even, so you could see, if you're a visual person, oh, these are the points of bone mets, and these are the points of soft tissue mets, the fact that he's catheters and incontinent, all those things just available on a glance. So you give him appropriate care. And then I took this and I painted it on a wall. There was a local delicatessen in my neighborhood that had 5 by 6 feet of space, and they said, yes, you can paint it there. All this time I was getting on Facebook and I was posting status lines, and I actually used Facebook as a caring bridge. I would tell everybody I knew what was going on in my husband's care and friend everybody that was friends with him, and it grew this huge network of people. And you know what's beautiful about that? They're all still my friends today. They're all still supporting us. And then I got on this really scary thing called Twitter. So who's on Twitter? A few people. Okay, so I'm going to tell you right now how powerful Twitter is. I was on Twitter because a toy store customer told me there's this guy named E-Patient Dave. This man, E-Patient Dave, has survived stage 4 kidney cancer, and you've got to talk to him. And I'm like, oh, yes, I have to talk to him. So how do I talk to him? They said, you've got to get on Twitter. I'm like, I don't know how to do that. They said, well, you're going to figure it out tonight. So that night, with the help of my 10-year-old autistic son, I figured out Twitter. And I sent my first tweet, which is, I want to find Christine Kraft and E-Patient Dave. And you know what? The very next day, E-Patient Dave found me. And then he called me. And then by that night, I was talking to E-Patient Dave's oncologist, a foremost authority on kidney cancer, on the phone. And that man was brave. Because you know what he was willing to do? He was willing to do the talk. You know the talk? That sometimes it's too late. Sometimes you can be 38 years old and the man who's the father of 2 young children, and the day you got into that hospital was too late. That talk had not been done ever to any of us in our family. But this man from Twitter, he told me. We met a lot of people in the e-health movement, the Health 2.0 movement, through Twitter, and had wonderful conversation with them, and they started supporting me and encouraging me to do something called blogging, which was equally scary. And all these things were happening as my husband was starting to go toward hospice because of our delightful conversation with that doctor and one other. My husband loved hospice. He thought it was the best ever. They took care of his pain. They were so nice. They didn't wake him up in the middle of the night. The food was good. We could get whatever we wanted locally, and he was so happy there. But after 3 weeks, the discharge nurse came up to us and said, so your husband's stable, so we need to send him home now. I'm like, well, we have a 1-bedroom apartment. How are we going to make that work? Well, have you considered moving? So we moved in about a 24-hour time frame from our 1-bedroom to a 2-bedroom that, thank God, was handicap accessible, with the help of 20 friends. And I took my husband home and I only had 4 chucks. I had 1 chuck under him, 1 chuck ready to go, 1 chuck in the wash, and 1 in the dryer to constantly keep him clean and so he wouldn't get bed sores. I had bruises all the way up and down my arms from trying to lift his body and care for him when we'd only see a hospice nurse or a tech every other day. On the 4th day, the hospice nurse said, I think we should go back to hospice. This is not easy in your home. And I'm like, what? Go back? You made us move. You made me uproot my whole family. Oh, that's how insurance works. You have to prove that you're not able to do it, and then you go back. I'm like, no, this is not how it works. I swore to him, I promised him this would be the last move. And then, on the night of June 16th, right before midnight, my husband called out, Reggie, my catheter blew. I'm like, oh, it's okay, I'll clean it up. And I called the hospice nurse, and she came in 2 hours. And so at 2 o'clock in the morning, she's placing a new catheter. And my husband says, oh, you are so good at that. And she says, yes, I was a VA nurse. And then she swept our floor. It's like, you don't have to sweep our floor. She's like, just go be with your husband. Then she left. And for the next 4 hours, I just talked with my husband. And it was just like scenic painting. We talked Stephen King and Jon Stewart, and we talked everything. We talked about our kids and all these great things, and sometimes it didn't make sense. Sometimes he talked like he was talking to somebody he knew when he was 6. But a lot of times it made sense, and a lot of times it was my husband again. And then at 6:30 he said, Reggie, you look so tired. You should go to sleep. I said, I will go to sleep. I slept for 1 hour because we had 7:30 meds. At 7:30 I got up. My husband was very compliant. And I made his little meds and his water, and I went to him, and he wouldn't wake up. I said, honey, it's your meds. You know you like to take your meds. So I crushed them up, and I put them in a spoon, and you know what he did? He managed to move his lips. He managed to swallow. And he never managed to talk again. 2 hours later, he couldn't hardly breathe. That was the sound. I ran for the children. I said, come on, kids, I think it's time. And we gathered around Daddy's bed, and we said, we love you, Daddy. We love you so much. And it's okay. It's okay to go. And we will miss you, but it's okay. We love you. And he stopped. And the hospice nurse came, and she said, you want to help clean the body? And I said, yes. And she said, you can just hold him, and I'll clean. And I held him. I held him for the first time in weeks, and he was warm. And I loved him so much. And then we had the funeral, and then we had the memorial service. And then I began to paint, and tweet, and blog, and Facebook, and do everything I could so great men like him don't suffer when they don't need to. So I made 73 cents, and that is a story of one man's electronic medical record and how powerful that is. And then we had the sing-along, and we said, where do we go from here? And that's the question I have for you today, because that's exactly where we are right now. See that painting? Helen Haskell helped make that painting. That is a painting of 17 different patient advocate authors. They have shields that are their books and pens that are their swords, because every single one of them had something horrible happen to a family member or themselves, and they wrote a book about it. A book usually based on how to survive your hospital stay. 17 books on how to survive your hospital stay. But there's this thing here, this DAM, give us our DAM data. It's called meaningful use. And it's by the high-tech legislation, and that gives us the story of the patient, because every one of those authors have a moment in their story when if they could have only read the medical record. Only that. Josie King, right here. She's right here, and that's Sorrel. She could have saved her child's life if she could have only read the medical record. It's a painting I did for my mother-in-law after my husband's death. That's all of her grandchildren and children as children. Because guess what? Inside of us, we're always still the child we once were. And everyone you treat is still that perfect being inside. And you must see that soul, that spark. That's a child's book. That's a bakery in 1980. Look at that cash register. Look at that phone. How many places do you go that have phones or cash registers like that now? This is a doctor's office. Up until a few years ago when I went to Kaiser, that's what my primary care office looked like just 2 years ago. That is unacceptable. Our world has moved on and we must move with it. This is an example that I've written of progress notes. Look, Dick, see Sally and Tim, funny, funny Sally, funny, funny Tim. Where does that come from? Oh, yeah, Sally, Dick, and Jane. If we have doctor's notes and nurses' notes that don't have the whole picture of care, if we don't include the whole story, the entire image of a person, we miss what's going on. Nurses' notes and doctors' progress notes are not sufficient as tiny little sentences. We must consider the whole of a person and how to make this work. We must look at visualizations within our EMRs. So many of us are visual learners. They say of a presentation like this, 55% of what you're going to retain is what you saw. So make what you see powerful. Out in Green Bay, Wisconsin, there's a place called Bellin Health. You know what they did during their EMR rollout? They named it after a patient. The EMR rollout is called Betty, because Betty Bundy was treated there, and how they found out about her was they had a strategy day away session where they wanted to find out how was their stroke team doing. The CEO, who used to be head of housekeeping, by the way, asked the team, hey, 6 months, a year out, how well are our stroke victims doing? He said, oh, we don't know. So they called it Betty. Hey, Betty, how you doing? It's Bellin Health. We just want to know how you're doing now a year later. And she said, what? Who is this? Bellin Health. Oh, you suck. You know, I went to your hospital 3 times in 3 days. You almost killed me. You couldn't find the medical records. You didn't know what just happened to me the day before. I almost died. Now, how many people, when they have that, just sort of walk away quickly? But not Bellin. They asked her to come and present in front of the entire group. She's part of their patient advisory council, and they have patients involved in every EMR workflow. At Sharp Health Coronado, they have a plan tree method. They go through the electronic medical record daily with their patients during every nurse's handoff. And then this is a jacket design I have of my son holding a netbook at a clinic appointment where they hand the people netbooks to build out their own electronic medical record. Now think about when you see children playing doctor. One child sits passively just sitting there, the other child's doing everything. We teach our patients, we teach them to be still and not part. But that clinic is teaching my son, you are part of this. And now when he goes to a doctor, you know what he thinks he's supposed to be able to do? Type his own information into the record. That is disruptive. And then there's companies out there that are taking in desire to help us become healthier into their own hands and doing weight loss challenges, even though they're not a doctor. They're just an EMR company. They don't have to do this, but they did. So here we are. Change is scary. You're on the HMS old way of doing business, and guess what? It's burning down. And you are on the plank. Now, fortunately, there's an HCAPS boat out there trying to help you out, but you're going to have to dive. And you can control this. You can control where you go. What really scares us? You know what these 2 paintings are? These are paintings of children who have died. All those little kids all died of medical errors. See, we light candles for them. We light candles for our dead. And we pray. And this beautiful jacket here is worn by Helen Haskell and is for her son Lewis. And it's called A Wishing Well in Never Never Land. I don't know if you know Peter Pan. He's based on a boy who died at the age of 15. He never grows up. It was written by the younger son in the family who watched his mother's extensive grief and how she never really could get over the death of her first son. So within this painting, we have Helen and how everything she does is seen through the light of her son. And that light shines on us all. So there's the walking gallery, and I have a jacket in it. See, I'm little Miss A-type personality. And I can take that and I can run with it. I can be powerful and an advocate and an artist, but it also can be an A of shame or a scarlet letter. but whatever it is, it makes you pay attention. And my children have joined. That's my eldest son. Painted in the painting is an eye through a door crack, but now he walks in a gallery. And any of you can join us too. You can walk into meetings like this one and wear your most personal soul, your story, your patient essence on your back, and watch how the dialogue changes. I got to meet Regina Benjamin at Meaningful Use final announcement. She was really powerful because she talked about how important medical records are, electronic medical records are for providers. And I explained how important they were for patients. And then I met her again at the big consumer engagement session at Health and Human Services, where they said they want you to be part of this. Right now, we are on public comment period for stage 2 meaningful use. Everybody in this room, please publicly comment that patients need access to their medical record timely, even before 4 days, and ideally, it should be an entire medical record. And that's my little son, Isaac. He is the I in HIT. He is the future of care as we change the system and make it where everybody gets the care they need. And that's my final picture that I want to show you. That's called the embrace. That's my husband and son, and it was based on a photo that was taken when he was sick. And my son is 6 now, and he doesn't remember much of his father, but he remembers that. The moment he got to hug him in a hospital bed. I want you to think of that when you help the people that you help. Thank you.